So pregnant woman in supine position, abdominal aorta, inferior vena cava, or placenta. The pressure is placed in the inferior vena cava. The exceptions to the supine position rule include pregnant women who have respiratory difficulties and or chest pain. So why do you place a woman in supine position? Because it places pressure on the inferior vena cava. A pregnant woman can be placed on her side with her legs slightly elevated to prevent further problems caused by the weight of the fetus on the vena cava. So the vena cava is what you're going to be careful with in a pregnant woman. Next, what causes respiratory problems in children? Asthma, it can be treated in an upper respiratory problems with macrolides like azithromycin, clarithromycin, and erythromycin. Extrinsic asthma, also known as allergic asthma, accounts for 50% of the asthmatics and occurs more often in children and younger adults. So extrinsic asthma, which is also known as allergic asthma, accounts for 50% of the asthmatics and occurs more often in children and younger adults. What is extrinsic asthma? Allergic asthma. It's 50% of asthmatics. It's more in children and young adults. Most patients with this form of asthma demonstrate an inherited allergic predisposition. Inherited allergic predisposition is very common in extrinsic asthma, which is allergic and is inherited mostly, and it's 50% of the asthmatics, especially young adults and children. Next, the cavernous sinus thrombosis from abscess of the upper lip. We're going to study this cavernous sinus thrombosis, the canine space and the deep temporal space. An infection in this canine space and the deep temporal space can lead to cavernous sinus thrombosis. Again, canine space and temporal space. Deep temporal space. Canine space and deep temporal space can cause an infection that can lead to cavernous sinus thrombosis by the spread of the infection via the ophthalmic vein. Important. Canine space, deep temporal space via ophthalmic vein. Again, cavernous sinus thrombosis from an abscess on the upper lip. It can be started in the canine space, in the deep temporal space, and it can be an infection that can lead to cavernous sinus thrombosis by the spread of the infection via the ophthalmic vein. Remember that veins do not have valves in this area, so the infection can move upward easily. Now, a lateral pharyngeal infection can transverse the retropharyngeal and prevertebral spaces and spread into the mediastinum. That is another way another infection can occur. It's also a very dangerous infection. So the first one is the cavernous sinus thrombosis. The second one is a mediastinum. Okay, remember, cavernous sinus thrombosis can be started in the canine space and the deep temporal space, and it can lead to cavernous sinus thrombosis by spread of the infection via the ophthalmic vein. Now, how can a infection get to the mediastinum? It can get there via the lateral pharyngeal a lateral pharyngeal infection. Lateral pharyngeal infection, which can transverse the retropharyngeal and prevertebral spaces and spread into the mediastinum. Now, with these will be between the medial pterygoid muscle and the pharyngeal constrictor muscle. Okay, hard to remember, but remember, mediastinum can be reached by infection via a retropharyngeal and prevertebral space, and this will be started in a lateral pharyngeal infection, and it goes through the pterygoid muscle, medial pterygoid muscle, and the pharyngeal constrictor muscle. Now, in a cavernous sinus, there can be a formation of a blood clot within the cavernous sinus. This area, the cavernous sinus, is at the base of the brain and drains deoxygenated blood from the brain back to the heart. The cause is usually from spreading infection coming from the sinuses, the ears, or the teeth. This is what a cavernous sinus thrombosis is. Okay, it's a thrombo, so it's a blood clot within the cavernous sinus. The bacteria that are associated with cavernous sinus thrombosis, which starts in the upper lip, it's Staph aureus and strep. Remember that Staph aureus is very common in skin, so an abscess of the upper lip can cause this. It is life-threatening because it is life-threatening and requires immediate treatment. There is a vascular congestion of the sclera and retina, periorbital edema, proptosis, ptosis, dilated pupils, absent corneal reflex, and thrombosis of retinal veins. Remember that the nerves that cross really close to the cavernous sinus is number 3, 4, the first branch of 5 and 6. So ophthalmic, trochlear, trigeminal, first trigeminal, and abducens. So an eye cannot be abducted. There is no constriction of the pupils, so they are dilated. There is no corneal reflex when you shine a light. Now, we will see infective endocarditis in the mitral valve or lesion of upper lip. This infective endocarditis in a mitral valve or lesion of upper lip because of a lesion of the upper lip. Okay, we'll see what it has to say. The prophylaxis dosages in adults and in children. Okay. Amoxicillin 2 grams 1 hour before the treatment. Amoxi 2 grams 1 hour before treatment. Clindamycin 600 milligrams 1 hour before So all of these, if you're going to do amoxicillin 2 grams 1 hour before, you have to see 50 milligrams per kilogram 1 hour before. So if you weigh 100 if you were 100 kilograms, you will have um, so amoxicillin 2 grams 1 hour before, or you're going to have 50 milligrams per kilogram. So 50 times 100, 5,000, I guess. Clindamycin 600 milligrams 1 hour before, and it's going to be 2 milligrams per kilogram 1 hour before. Cephalexin or cefadroxil 2 grams 1 hour before. Amoxicillin 1 gram, amoxicillin 2 grams 1 hour before, 50 milligrams per kilogram. Clindamycin 600 milligrams 1 hour before, 20 milligrams per kilo. Cephalexin or cefadroxil 2 grams 1 hour before, 50 milligrams per kilogram. And clarithromycin 15 milligrams per kilogram, and clarithromycin or azithromycin, which are macrolides, come in 500 milligrams 1 hour. Now, if you do ampicillin 2 grams intramuscular or IV, ampicillin intramuscular or IV 30 minutes before, and it's 30 milligrams per kilogram every 30 minutes. Clindamycin 600 IV 20 milligrams per kilo 30 minutes before. Cefazolin 1 gram intramuscular or IV 25 milligrams per kilo 30 minutes before. Now, we're going to see a congenitally missing tooth. When it's the congenitally missing tooth affected, when it's in its initiation stage or the proliferation stage, because if it's missing, then it cannot pass initiation or proliferation. Remember that initiation, it's a bud initiation, a bud stage, or a cap stage. In cap stage, looks like a cap and it's starting to proliferate. The cells are starting to proliferate. So this is when there's going to be a missing. When the tooth is going to be affected and thus will be missing. Now, what happens when you have referred pain to the ear? You're having a problem in mandibular molars. Ear mandibular molars. Now, there is a tricky question. A tricky question talking about aversive conditioning and about positive reinforcement. Aversive conditioning is punishment for doing the wrong habit. Aversive conditioning. Punishment for doing the wrong habit. And positive reinforcement In positive reinforcement, there's positive consequences that increase desired behavior. So aversive conditioning, there will be something averse if the conditions are not reached. In positive reinforcement, you reinforce a thought or a behavior by acting positively, by a positive consequence. Now, a cohort, retrospective cohort and prospective cohort are two things. The retrospective cohort evaluates the effect that a specific exposure has had on a population, i.e., occupational hazard. The investigator chooses or defines a sample look at a group of population at one specific time period in the past. So that's a retrospective, looking back in the past in evaluating the group of population, and you will evaluate the effect of a specific exposure that that population had to something, for example, a hazard. Okay, now the prospective cohort, it's a study that follows a group through some period of time and will evaluate the risk factors by means of surveys to help predict an outcome or detect an outcome. So retrospective is taking that group and looking back at what has happened and define a specific, evaluate the effect that a specific exposure has on that population. And the prospective is looking at the future and surveying what the people are saying, what the group or population is saying regarding to the risk factors and evaluating them. Okay, so next, the question is, what percentage of the water in the US is fluorized? And the percentage of fluorization in water is it's 85%. 85% of the water in the US has fluoride, and the amount of fluoride that 85% of the water in the US has is 0.7 to 1.2 parts per millimeter. 0.7 to 1.2. 0.7 to 1.2 parts per millimeter is in the water of 85% of the water in the US. Okay, 85% of the water in the US has fluoride, and the amount of fluoride that it has is 0.7 to 1.2. Now, we're going to see what sensitivity is. Okay, sensitivity is the percentage of persons with a disease who are classified as having the disease. This is a true positive. So the sensitivity has a formula of, we're not gonna learn it right now, which is the sensitivity is measured by true positive divided by true positive plus false negative, and this times 100%. So if you have a true positive, you will divide that by the true positive plus the false negative. Okay, and that's how you determine sensitivity. Now, specificity is the percentage of persons without a disease who are correctly classified as not having the disease. Okay, so specificity is the true negative divided by true negative plus false positive. Okay, times 100%, the percentage. So again, sensitivity is the percentage of people with the disease who are classified as having the disease. So that is a true positive. Now the specificity is the percentage of persons with the disease who are correctly classified as not having the disease. That's a true negative. Why? True positive insensitivity, because the person does have the disease, and specificity does not have this disease. So in a nutshell, these two values are directly inverse to each other. As one goes up, the other goes down. So as sensitivity goes up, specificity goes down. Specificity, remember, that is a percentage of persons without the disease who are correctly classified as not having the disease. So you have 100 people, and your specificity is going up. It means that the percentage of the persons without the disease are being correctly classified as not having the disease. So you're being more specific because you know who doesn't have it. And in sensitivity, the percentage of the persons with the disease who are classified as having the disease is a true positive. Again, I don't think I explained well. So they're directly inverse to each other. As one goes up, the other goes down. So if the amount, the insensitivity, the amount of person with the disease of the people are classified as having the disease, then this is going up. It's being a true positive. So the specificity is going down. On the other hand, if the and also, I mean, in the same example, if the specificity, which is the percentage of person without disease who are correctly classified as not having the disease, is going down, the percentage, it means that you are correctly classifying people that don't have the disease as not having the disease. So you're being more specific, okay? So that is a true negative. So you're finding out that all these people don't have the disease. So as that number goes down, your specificity number, then your sensitivity number goes up, because this means that the percentage with the disease are being classified as having the disease. So it's, once you kind of understand this, it's not very hard, because if you are correctly classifying people as not having the disease, then that means that the persons that do have the disease are being also more accurate in your measurement. So the percentage of the ones that have the disease are being classified correctly also. So that is a true positive. Anyway, so what population, next question, what population will have recurrent decay? Blacks, whites, Hispanics, or Native Americans? So we're going to study about this. Caucasians had a mean coronal DFS, which means decayed field surfaces, twice as high as African Americans. What does this mean? It means that a white person who is classified as having a diseased surface is taking care of it. Caucasians have had mean coronal DFS twice as high. So if you have a white and a black kid, and the Caucasian has 5 fillings and the black has 5 fillings, not 5 fillings, 5 cavities. The Caucasian has 5 cavities, the black has 5 cavities. If it's never mind, let me step back. You have a white and a black kid. The white kid has 6 cavities, the black kid has 6 cavities, and this means that this white kid will have 3 of these cavities filled, whereas the black kid probably will not have any filled. So they can have the same amount of cavities, but the white kid has more access to treatment. So Caucasians have mean coronal decayed filled surfaces twice as high. Now, the proportion of population that has untreated coronal caries for entire population is 3 times as higher in African Americans and Caucasians. Root caries is the same in both populations. So, filled cavities are twice as high in Caucasians, and root caries is the same. Now, we're gonna see about the water spew for maxillary sinus, the reverse towns for condylar neck fractures, and the oblique view for x-rays in the next video.